Are you caring for a loved one with dementia? You don't have to figure this out all on your own. Welcome to Truth, Lies, and Alzheimer's, the show that helps you reimagine a new relationship with your loved one, a relationship a little more free of stress and anxiety. Join host Lisa Skinner and her 30-plus years of experience as she guides you on a new path to a better relationship with those you care for. Here's Lisa.
Hello, everyone. Welcome to another new episode of the Truth, Lies, and Alzheimer's Show. I'm Lisa Skinner, your host. Today's episode is about caring for a loved one with dementia, and I'm going to include case studies, vignettes, and practical checklists to help you plan, act, and sustain care with dignity and resilience. This is our topic today. Now, many of you already know that caring for a loved one with dementia is one of life's most demanding responsibilities. Anybody want to debate that? Okay. It blends daily logics with deep emotional currents, anticipatory grief, fear of the unknown, and the constant pressure to ensure safety and quality of life. Caregivers often juggle medical appointments, personal care tasks, escalating behavioral changes. There's financial considerations and the very complex navigation of healthcare and social services. The intensity can surprise even the most prepared families, and the progress isn't linear. Some days feel manageable, others are exhausting, bewildering, even frightening. In my 30-year career helping families and caregivers through the maze of dementia, most people are completely caught off guard and are unprepared to manage a neurodegenerative disease that declines our cognitive function. It typically happens as a result of a crisis that unexpectedly occurs, and then into panic mode they go, trying to figure out what to do next, but often with little to no advice or direction from anyone, including the medical teams. So this is what I'm discussing in today's episode in case you find yourself in this dilemma. I'm going to include some real-world case studies and vignettes to illustrate common and uncommon situations, followed by structured checklists that you can adapt for your own situation. The goal here is to help you reduce risk, protect your own well-being, and preserve dignity and connection for the person you're caring for in a proactive way. So part one of this presentation is real-world scenarios that mirror much of what we encounter on a day-to-day basis in dementia caregiving. So case study number one is called The Quiet Crisis, a Mother's Silent Decline. So the summary of the scenario, here it goes. Mary, who's 78 years old, she has early stage Alzheimer's. She lives with her daughter, Marjorie. And over several months, Mary becomes increasingly forgetful. She's misplacing items and has trouble with her balance. Margie, who is juggling a part-time job and 2 school-aged children, notices that her mom's fatigue and dehydration, but she delays seeking help because she insists that her mom is just fine. So what happened here? Well, a couple things. There were small missteps escalated due to missed doses, missed meals, and missed appointments. Mary became socially withdrawn, which masked her early cognitive signals. She had a minor fall, which occurred at home, revealing there were unsafe conditions, such as a loose rug and a cluttered hallway in this case. So the key lessons here: early signs can be subtle and easily attributed to normal aging. So caregivers must plan for emergent events, even when symptoms seem mild. Sleep, hydration, and routine safety checks do matter. So practical takeaways from this scenario: begin a simple home safety audit and a basic health log to include mood changes, appetite changes, sleep changes, medication changes. Schedule a primary care visit to review cognitive concerns and comorbidities, which are other health conditions, along with dementia. Identify a trusted family member or friend to share in the caregiving duties to help prevent one person from completely burning out. Here's case study number 2, and I'm calling it the communication gap when words fail. Here's the summary. John, a 72-year-old man with vascular dementia, lives independently with minimal assistance. His wife, Jackie, acts as the primary caregiver, but she struggles as John starts to repeat questions, misinterpret instructions, and becomes quite agitated during routine tasks like dressing or mealtime. What's happening here? Well, we have repetitive questions, and that's increasing the entire anxiety of the household. The frustration leads to shouting, which intensifies both their agitation levels. Jackie feels isolated, and then she starts avoiding social activities. What's the key lesson here? That dementia erodes language, but often leaves emotional needs intact. So you want clarity. You need to practice patience and validate feelings, because these things can help reduce any conflict. Routine and predictability ease transitions between activities. The practical takeaways here: use short, concrete phrases, one instruction at a time. Acknowledge the person with dementia's emotions first by saying something like, "I can see you're upset right now. Let's try a slow, quiet routine." Build a visual schedule and consider cue cards for daily routines. Here's another case study. I'm calling it the safety net breaks, a crisis in the night. The summary of this one is Andy. He's 81 years old, and he has been diagnosed with Lewy body dementia. He experiences nighttime confusion and episodes of wandering. Now, his daughter Nancy has limited nighttime support and also works a full-time job during the day. This one night, Andy left the house unnoticed and is eventually found several blocks away, completely frightened and disoriented. He didn't know his name. He didn't know where he belonged. So what happened here? Well, clearly a lack of 24/7 supervision that created a safety risk. Andy's intermittent sleep disturbances contributed to his confusion and disorientation at night. Nancy's sleep was severely disrupted, affecting daytime functioning and mood. So the key lessons here is, first of all, nighttime safety is a critical focus. Wandering can happen at any time. Sleep disturbances amplify cognitive and behavioral symptoms. But preparedness reduces risk and levels of caregiver stress. So, what are the practical takeaways in this scenario? You could install door or space alarms that are appropriate for a person who wanders and secure the outdoor exits. Create a secure sleep routine and consider in-home respite for occasional night coverage. I say this time and time again. With dementia, it truly takes a village. One person cannot do this alone. So discuss a stepwise plan for nighttime care with maybe your healthcare team. Here's another case study. I call it the financial edge, hidden costs, and tough choices. Summary: Sophie, who's 65 years old, cares for her mother, Edith, who has moderate dementia with comorbid arthritis. Edith's medical needs include frequent appointments, medications, home modifications, and periodic respite care. However, Sophie works part-time, and caregiving is eroding her wages and her personal savings. So what's happening here? Well, the out-of-pocket costs, which quickly accumulate due to the medications, the supplies, the transportation. So a long-term care insurance policy does exist here in this family, but is very difficult to navigate. And Edith's assets are extremely modest. The family faced a difficult choice about in-home care versus assisted living. Key lessons: dementia care has both direct and indirect financial costs that accumulate over time. Early planning and legal preparation can prevent financial shocks. Economic stress worsens caregivers' well-being and decision-making quality. So here's some practical takeaways if you find yourself in this situation. Create a budget that separates discretionary costs from essential care items. Gather all the financial documents, policies, and benefit eligibility information and have them stored in one place that is easily accessible. You know exactly where they are. Consult an elder law attorney or a benefits advisor to discuss doing a power of attorney, having an advance directive, and care funding options. Case study number 5, the systemic gap, barely surviving without sleep. Summary: this is about Roger. He's 69 and he has frontotemporal dementia and lives with his daughter, Lena. Access to dementia-specific services is very limited. They live in a rural area. Lena does work full-time. Arranging respite care is quite difficult due to long wait lists and transportation barriers due to where they happen to live. What's happening here? Lena feels trapped, and her own health and work are suffering as a result. Without respite, caregiver burnout increased, and Roger's needs eventually escalated. The lack of coordinated services led to inconsistent care and poor communication among providers. Key lessons here. Unfortunately, Rural and underserved communities do face special barriers to dementia care. But please know that caregiver burnout is not a personal failure. It's a systems issue that demands support. Access to integrated services like care coordination, respite, transport is essential, but hard to find. Some practical takeaways: explore regional aging networks and community health workers who can navigate and help you with the local services. Seek help from social workers at hospitals or memory clinics who can connect you with some of the local respite programs that are available in your area. If available, join or form local caregiver networks to share resources and advocate for better access. I'm going through some checklists that you can use immediately. This is part 2 of this episode. So the first checklist that I am going to go through is pertaining to home safety and daily routines. And you can adapt this for your home. So the first thing you want to do is remove any trip hazards. For example, loose rugs and or clutter in any walking paths. You want to improve lighting in the hallways, the stairways, and bathrooms. Install grab bars in the bathroom and shower. Check the water heater and smoke detectors to make sure that they are functioning and working properly. Replace batteries if necessary. Create a simple, predictable daily schedule that includes meals, activities, and bedtime. People living with dementia do much, much better on a fixed routine based on familiarity. And familiarity does represent safety and security for people living with dementia. Label all containers and medications clearly. Use large print or color coding if that's helpful for you. Keep important documents in a single accessible binder or digital folder. And then, this is important, always have a go bag prepared that includes essentials if your loved one needs to go for an emergency hospital visit. Establish a safe sleep routine to reduce nighttime confusion. The next checklist pertains to communication and behavior management. So here are some recommendations. When you're communicating with your loved one or the person you're caring for, use one instruction at a time in simple language. They do not process information the way they did when their brains were healthier. Validate their feelings first before offering a solution. Offer no more than 2 choices at a time and then allow them to decide which one they prefer. Use reminiscence approaches like music, photographs, and other familiar objects that can trigger memories for them. Prepare a 3-step plan for some of the common triggers that you have identified, like what makes them angry, what gets them agitated, and what gets them on that repetitive question hamster wheel that you don't know how to turn off. Create visible reminders for routines using calendars or checklists or even cue cards. And then the next list is pertaining to medical coordination and records. So one of the things that you might want to do is assign a primary caregiver or a care manager as the main point of contact. Keep a single up-to-date medication list, including dosages and side effects. Maintain copies of key medical records their insurance policies, and advance directives or any other medically related or legally related documents that you have prepared. Schedule regular care planning meetings with their physician and care team. Document changes in their cognition, behavior, sleep, appetite, and moods. So in terms of respite and support planning, try to identify in-home respite options in adult day programs before a crisis happens. Request trial sessions. Explore volunteer and community support opportunities. Establish a rotating caregiving schedule with trusted relatives or friends. Communicate with employers about needs and flexibilities where possible so they understand what you're dealing with on a personal level. And then there's financial and legal planning. You want to inventory all the assets, policies, and potential benefits that are available to your loved one. Arrange power of attorney and healthcare proxy and ensure accessibility of the documents. Create or update an advance directive and living will. Develop a monthly caregiving budget. Track the costs and reimbursement opportunities. Consult elder law or benefits professionals for long-term care planning. And now, here are some practical pathways for immediate action. This is a 30-day plan. So in week 1, this is the foundation. Schedule a healthcare appointment to review cognitive symptoms and the comorbidities or other medical conditions that your loved one may also be experiencing. Gather financial and legal documents, identify a power of attorney, beneficiary designations, and advance directives. This is where you want to conduct a home safety audit. Now, this is going to change as they progress through the stages of the dementia. But now is when you want to implement the essential safety fixes. Week 2, this pertains to communication and routine. Establish a visual daily routine. You can create cue cards for key activities. Develop a 3-step communication script for common scenarios. A different scenario will inevitably arise, out of nowhere on a regular basis. So make sure that you include new scenarios that probably will turn out to be common. Start a symptom and mood log. Review patterns with a clinician at the end of the week. Week 3, care coordination and respite. This is where you'd like to identify a primary caregiver or care manager who can coordinate and help you with available services. Explore respite options. In home, you take them there. Look to see if there's adult day programs in your community, and you can schedule a trial visit. Set up a 2 to 3 week rotating caregiving schedule with trusted allies. And then week 4, financial and legal security. Finalize the power of attorney and the healthcare proxy and advance directive copies. Share with your care team. Create or update a simple caregiving budget. Assess any insurance and benefits and the eligibility. There are certain criteria that will trigger insurance and benefits eligibility, so know those ahead of time. Plan for long-term accommodations and transitions, if needed, including potential assisted living options if and when the time is inevitable. So in this Last part, I'm going to share with you some case vignettes for reflection and discussion. So the first one, a family rally building shared responsibility. The Smith family holds a weekly family meeting to discuss care duties, finances, and emotional needs. That's a great idea. They create a shared online document with responsibilities, a respite schedule, and a budget. The eldest sibling travels to help with medical appointments. A neighbor volunteers to help with transportation. The caregiver reports reduced stress, knowing help is available and planned. Now, this vignette demonstrates how formalizing roles and rehearsing contingencies reduces chaos and anxiety. The takeaway, structured communication and shared responsibilities prevent burnout and ensure continuity of care. Next vignette, the advocate's moment, navigating the system. Maria, who cares for her father with mixed dementia, it means he has more than one brain disease developing in his brain simultaneously, which is actually very common, learns to speak with confidence to healthcare providers. She asks for a care plan, a detailed medication review, and a referral to a social worker who can assist with benefits and respite options. With a single point of contact and a clear plan, the family experiences improved care coordination and reduces confusion during transitions. The takeaway here, proactive outreach and advocacy can unlock services that you may not have even been aware of and reduce fragmentation. Next vignette, the rural challenge, a community response. In a rural community, volunteers coordinate transportation, home safety checks, and social visits for people with dementia. A local clinic provides telehealth visits. Caregivers receive in-home training on wound care and medication management. When families are isolated by geography, community networks offer essential lifelines. The takeaway, local collaboration and community-based resources are vital for families with limited access to formal services. And then finally, the core message, what this means for you. Dementia caregiving is definitely a marathon with frequent sprint moments. Expect ups and downs and plan for contingencies. Early, proactive planning yields better outcomes for both the person with dementia and the care team. You don't have to do this alone. Build a care team, seek respite early, and utilize local resources. Systemic supports, which are policy and community programs, really matter. Advocate for clearer access, streamlined benefits, and affordable respite. And here are some important considerations. If you're in a crisis or safety is at immediate risk, like wandering at night, aggressive behaviors, risk of injury, contact emergency services or your local crisis right away. If you're dealing with financial strain, consider talking to a social worker, an elder law attorney, or a benefits advisor who can help you explore your options like respite funding, long-term care insurance, and public benefits. If you or the person you're caring for has language or cultural needs, look for resources offering translation and culturally competent care options. These case studies and vignettes have illustrated a variety of typical trajectories and may help care partners recognize certain patterns and anticipate needs and discuss options with a variety of professionals. Remember, your loved one can seem fine one moment, and then things can change in a heartbeat. So, today's episode has provided you with recommendations and ideas of how to be better prepared for dementia. So that'll conclude this episode today for the Truth, Lies, and Alzheimer's show. I'm Lisa Skinner, your host. And as always, I will be back next week with another new episode, especially prepared for you. So in the meantime, as I always say, please have a great rest of your week. Stay happy and healthy, and I'll see you back here next week. Thanks again. Bye-bye.
Thank you for listening to Truth, Lies, and Alzheimer's. We hope you found something in today's episode that helps. We understand that caring for a loved one with dementia can be the challenge of a lifetime, but you don't have to do it alone. If you're ready for exclusive access to even more great content and resources, head on over to Facebook and join Lisa's Minding Dementia Support Group. We're a community of like-minded caregivers, and we're here to help.